Imagine waking up at 3 in the morning.
Oh, that is just the absolute worst time.
Right. The house is like completely dark. The street outside is dead quiet. The rest of the world is deeply asleep. Everyone is just fully powered down.
Yeah.
But inside your body, there is this blaring, deafening, 5-alarm fire siren just going off.
Yeah.
And it's relentless.
Just screaming at you.
Exactly. It's screaming that something is critically wrong, that tissue is being destroyed,
Yeah.
that you are in immediate catastrophic danger.
Right. But then...
But you look around, and there's no fire. There's
Yeah.
no new injury at all. There's just the alarm ringing endlessly in the dark.
Which is terrifying.
It is. And that is the nightly reality of chronic pain.
It really is. And it's a reality that completely upends our standard, comfortable view of medicine.
How so?
Well, we kind of want medicine to be like mechanics, right? If a car is making a weird noise, you just find the broken belt, you replace it, and the noise stops.
Yeah, cause and effect.
Exactly. We expect a direct, visible correlation between tissue damage and the sensation of pain. But with chronic pain, that linear correlation just completely breaks down. The hardware itself has literally been rewired.
And that invisible rewiring is exactly what we are unpacking today. So, welcome to the deep dive, everyone.
Glad to be here.
If you're listening to this and you've ever, had a doctor look at your totally normal MRI and tell you that your pain is just stress.
Ugh, the worst.
Right. Or if you've watched a loved one slowly retreat from their life because their body has become this unlivable space, you know how maddening this diagnostic landscape is.
Oh, absolutely.
So our mission today is to dive into the invisible heavy weight of this disease state. We are synthesizing a massive stack of research today.
A really big stack.
Yeah, ranging from the landmark Stubbs et al. Umbrella review, which, get this, analyzed nearly 1 million psychiatric patients.
Such a massive data set.
Right, down to nuanced clinical guidelines, occupational health frameworks, and some really profound lived experience advocacy materials from the U.S. Pain Foundation.
And what emerges from looking at all this data from that macro epidemiological level all the way down to the micro reality of a single patient's Tuesday night is that we have to fundamentally discard the outdated notion that chronic pain is just a physical symptom.
We have to throw it out.
Right. It is a complex biopsychosocial disease state. It doesn't just hurt. It fundamentally alters a person's reality, their identity, and literally how their brain processes information.
Okay, let's unpack this. Because to understand the psychological devastation of chronic pain, we first have to understand the biological mechanism.
We do.
And we need to get past that basic, I touched a hot stove and pulled my hand away level of understanding.
Yeah, the textbook definition.
Right. We know that acute pain is a protective mechanism. But what is physically happening in the body when that acute pain becomes chronic?
Well, the International Association for the Study of Pain, or the IASP, has a really clear definition here. They state that pain is always, always a personal, sensory, and emotional experience. Always. No matter where it hurts in your body, the brain is the thing processing all of it. So this is where we have to look at the neuroplasticity of the central nervous system.
Okay, break that down for me.
Sure. So when you experience acute pain, say you have a severe lower back injury, your peripheral nerves send these nociceptive signals, basically danger signals, up your spinal cord to your brain.
Okay.
Your brain processes that data and produces the sensation of pain to force you to stop moving, right? So the tissue can heal.
So that's the accurate fire alarm.
Exactly. That's the alarm working as intended. But in chronic pain, something called central sensitization occurs.
Central sensitization.
Right. Because the nervous system has been bombarded with these danger signals for so long, the system actually alters its physical structure and its chemistry to become more efficient at delivering them.
Wait. So the body is essentially learning how to be better at being in pain.
Precisely. That's exactly what's happening. The threshold for what triggers the alarm drops dramatically.
Yeah.
The pain receptors in the brain and the spinal cord become highly, highly reactive. Wow.
Yeah. To use an analogy found in a few of the physiotherapy frameworks we reviewed, it's like having a volume knob on a radio that just gets stuck on loud.
Stuck on maximum volume.
Right. So normal sensory inputs like light pressure or a slight change in the weather or just the baseline mechanical function of moving a joint, they get amplified by the central nervous system into agonizing pain.
That's incredible.
Yeah, the pie chart from the sources really illustrates this well. It shows that tissue damage and inflammation is only one small slice of the overall pain
Is this
experience.
just like...
Yeah. The brain's perception and environmental factors actually make up the rest of the pie. The source of the pain is no longer just the tissue in the lower back, it's the central nervous system's processing center.
Okay, wait, let me push back on